Tonight, U.S. airports on high alert, screening passengers for symptoms of a deadly new virus.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
When COVID-19 emerged in Africa in early 2020, Africa's CDC quickly coordinated the diagnostic response in collaboration with partners, expanding the number of countries with PCR testing capacity from 2 to about 55 member states within a few months. Staff from national reference labs of each member state were trained on the testing for COVID-19 using PCR through face-to-face workshops. From there, member states had to quickly expand the testing capacity and ensure sufficient test coverage to detect and manage COVID-19 cases. This required a collective effort to share resources, knowledge, and guidance to ensure that no country was left behind despite travel restrictions. And that is where the LabCoP played a critical role.
LabCoP was established as an opportunity to take advantage of the innovative practices and solutions that were being created across different healthcare systems in sub-Saharan Africa. LabCoP, through their webinars and other learning innovations, provides structured discussions where key leads from different countries or different organizations share learnings and creative practices that they've been able to implement in their countries.
The LabCoP discussions lead to identification of proven solutions that work, that are then linked to funding, that can then be used to close the gaps in the viral load cascade, and in the end, accelerate the scale-up of diagnostics.
Although this was an entry point to improve laboratory systems, we had hoped that we would expand to other diseases such as TB, malaria, and other priority diseases. So when COVID-19 emerged, and particularly in terms of testing, it required the same systems that HIV had already been using. The LabCoP platform became a unique forum in which we could actually push the agenda of making sure that best practices and new knowledge coming in for SARS-CoV-2 diagnostics could be disseminated as fast as it can.
LabCoP began helping to combat the COVID-19 pandemic by moving quickly and establishing a platform for coordinated action. And this was in the context of a rapidly evolving scientific and technical landscape and amidst travel restrictions.
So immediately, the LabCoP provided that unique opportunity to continue these webinars.
The topics that were addressed were very diverse, and it could at some point include some training to support the frontline workers in detecting the SARS-CoV-2. But then the topics really evolved as the scientific agenda also evolved, and it started by understanding what are the best tests out there that can be used for molecular testing, and then the conversation shift to the clinical and public health utility of antigen and antibody assays and how they could be used on the ground in combination. And finally, we had presentation from the countries as they were becoming more confident implementing all those tools.
The outcome of these conversations are a synthesis of guidelines and best practices for strengthening laboratory systems. And these are available in the ASLM website that countries can refer to when addressing gaps within their countries. We have collaborated with organizations such as FIND, IQVIA, and the Korea World Bank, among others.
FIND was interested to partner with ASLM on the COVID-19 echo sessions because we were able to keep countries informed of the latest information, including independent evaluations, and allow manufacturers of validated technologies to hear country needs and address challenges.
WHO is very supportive and interested in being a part of the ASLM Echo Sessions. These sessions have helped us to engage with a number of different stakeholders, from Ministry of Health personnel to civil society to the private sector. And those engagements are really important for our guideline development process, as well as other key processes within the WHO structures. And it's really helped the WHO to disseminate information as well as gain that feedback.
With the coming of the COVID-19, all what we've seen is that the laboratory has become very, very critical for diagnostics and expansion.
Global Fund launched a C19 COVID-19 response mechanism to provide funding to countries to respond to COVID-19. LabCoP helped Global Fund to share its response mechanism details. It has really helped the countries to respond effectively to the epidemic.
The LabCoP program managed to help us develop quite substantive tools that we are currently using, not for viral load only, but we have also used for other tests. So when we then had the COVID pandemic, the benefits of LabCoP came in very handy, and we did not have much problems in responding swiftly to COVID-19 as far as laboratory testing was concerned.
Cette communauté de pratique de laboratoire a été très important, a été d'un grand secours pour la RDC. Les échanges que nous avons avec les autres pays nous a apporté l'expérience des uns et des autres, comment eux s'en sortent. Et ces exemples-là nous ont aidé aussi à améliorer notre pratique sur terrain par rapport à la réponse au COVID.
Hello and welcome to the ASLM special COVID-19 session number 9. ECO sessions have been largely successful. We have garnered over 28,000 connections from among scientists, program managers, diagnostic manufacturers, the civil society, frontline health workers, and many more from over 100 countries.
Through LabCoP, we were able to have access to suppliers, access to regulators, organizations, and different bodies, both in and outside the continent. Intervention became better with time as practices were quickly adopted or adapted from what we learned from other countries, and many laboratories were able to scale up their testing. Even when physical travel was restricted, information was never restricted.
My name is Rufus Nyaga, work with APHL in Kenya.
LabCoP gives a strong voice to African countries in that they have a forum where they can shape the agenda of the laboratory system strengthening and diagnosis scale-up. And this makes emergency interventions better tailored to the reality of the continent.
COVID-19 accelerated addressing some of the important questions around the laboratory system and networks. How can I utilize the resources that are already in place, the diagnostic platform I use for HIV or TB? How can they now be retooled and used for the COVID-19 while I am still keeping the gains for the HIV and the TB program? All of these questions are now being utilized in such a way that they can address also problems for the antimicrobial resistance surveillance, the tuberculosis program, the hepatitis C, etc. And I think that this really expands the horizon on how we are now discussing to strengthen the laboratory system in countries of Africa.